COVID-19 talk with local health authorities. Joining me is Dr. Maria Rivera, representing Harris County, Dr. David Persse, representing the City of Houston. Special thanks to Kathy Finninger, past president of Rotary Club of Houston. Thank you also to Morgan Ash, our producer. I'm Stephen Williams, the director of the Houston Health Department. Y'all can pretty much guess what the first question is about. FDA expands emergency use of Pfizer to 12 to 15-year-olds. When will this begin here? It's already begun, hasn't it?
Yeah, so the Harris County Public Health, City of Houston, we started administering the Pfizer vaccine, or we will at noon today when NRG opens, to all 12 to 15-year-olds. You can go ahead and make an appointment, or you can come directly to the site. If you do come, there has to be a parent present if your child is 12 to 15, unless you give written consent in advance. There's consent forms on the website as well.
So that's good news. Moderna's single-shot booster with 50% of the original formula seems to be doing well. In theory, if we need a booster, do we stick with the brand first received?
Yeah, so I'll take that one. So there have been some studies looking at if people take vaccine A the first time, then vaccine B the second time. They're very early. Between the mRNAs, this is a prediction on my part, I think that between the mRNA vaccines, there will probably less of an issue than between a viral vector and then an mRNA. But quite honestly, I don't think that there's going to be a whole lot of difference, because in the end, what they do is they produce a spike protein that your immune system responds to. So we have to wait and see to find out. But we'll just have to wait and see. But I don't anticipate there's going to be a big problem. We'll find out though.
The UK is looking at a mix and match vaccine. In countries that gave a viral vector vaccine, they're encouraging an mRNA as the second. It has been mentioned that two different types may give you a better immune response. With competition between the pharmaceutical companies, is it even possible that a mixed dose could happen? You just answered that.
Yeah, and I do know that there are studies going on where the pharmaceutical companies got together. They are actually looking at doing mixed. Where it'd be part mRNA and then part viral vector vaccine. So they're already working. Those studies have just begun, and we'll have to wait and see what they show.
What is the latest on the effectiveness in one-dose Moderna vaccine for 12 to 18-year-olds? I don't know.
Of one dose of the Moderna dose on 12 to 18-year-olds. I think that information, as far as I know, hasn't been released. The 12. Especially the 12 to 18-year-olds are they're still being studied, still under trial. That information has not been presented to the FDA, has not been presented to the CDC yet. And so we'll wait and see what it's showing. I think that we expect it to be good news. We expect it to be very effective, similar to what we're seeing in the Pfizer vaccine in that age group, which is why we are able to start vaccinating kids of that age group right now. But I don't think that we know the answer to that question yet.
But the full regimen is 2 doses, right? Not the one.
Exactly, and the full regimen is 2 doses, absolutely.
I became pregnant around the same time as I received my vaccine. Not me now. Any issue that you might know?
Do you want me to take this one?
Yeah.
Yeah. So no issues that we know about as of now, and this has actually happened in some of the studies where people that were in the studies, one of the requirements was that they weren't pregnant before they started the studies, but what happened was that a couple women did become pregnant during the study, right in between the first and the second doses. There was no adverse events that were reported. There's no reason to believe that there's any complications or events that are going to be reported from this. And the latest studies that have been looking at pregnant women show that it's very safe in pregnancy, and so there shouldn't be any reasons to worry.
I volunteered at one of the vaccine sites, but there was not a lot to do. Is there any way to find locations that need help? That's probably due to the traffic that we're having and decline in the uptick. It will be interesting to see what happens now that Pfizer is available for those that are 12 and above.
Agreed.
Go ahead.
I just agree with you said. I don't obviously know specifically what this person's experience was, but when you have the vaccine center set up and nobody shows up, there's not a lot of work to do.
Yeah, I experienced that this weekend at one of our vaccine sites, and our affiliate ended up sending some of the staff members home. Vaccination rates are dropping off. We just talked about that. If they keep going down, what does this mean for the timeline end? What does the end look like, or is there an end? Good doctors.
Yeah, I'll take a stab at this because it's one of my favorite sort of topics. And this raises the question that Dr. Rivera and I have talked about many times. When does the pandemic end? And it's probably not going well. So the pandemic, using that term, will come to an end at some point, but the virus isn't going to go away. It's going to switch over. It's going to become endemic, which means it persists. And much like the flu, we have it every year. We have to deal with it. Now, the flu is seasonal. COVID so far does not appear to be seasonal. We had that big spike in July, and we had a big spike in January. So it doesn't appear to be. But when does it end is a difficult question to answer, because to some degree, this is just me talking, but when we get to the point where nobody goes to get vaccinated anymore, when all those people who are willing to get vaccinated have been vaccinated, which we're not there yet, because there are still people who are willing to get vaccinated. It's just difficult for them to get vaccinated. So we have to do our due diligence, which we're doing, to get out and get those folks vaccinated. But once we have everybody vaccinated, except for those who staunchly refuse to get vaccinated, that's kind of one definition of the end, because there's nothing more that we can do. The governor has already taken away the mask mandate and all of the other restrictions. And so that will then be up to individuals to decide whether or not they want to wear a mask, whether or not they want to social distance. And at that point, we'll then be looking at how many people per day are getting hospitalized. By the way, in Houston, Harris County, it's about 100 people per day get hospitalized from this virus. So this virus is still causing a lot of problems. And also remember, about 10% of those who get hospitalized die. So I still personally, I feel that those numbers are way, way too high. But regardless, I don't know if that answers the question or not, but that's what I've got to say.
Dr. Maria Rivera, any comments on that? Because I think it is an interesting question, and it's about what the future looks like, and what are our lifestyles going to look like.
Yeah, no, and I absolutely agree with Dr. Persse. I think that it's unfortunate that vaccination rates have slowed down. They've slowed down before we wanted them to slow down. We're nowhere near reaching that mark of even potential herd immunity. And so it will be at what point does society decide that we're okay with the number of deaths, that we're okay with the number of hospitalizations. So I completely agree with Dr. Persse. I hope that we can continue to encourage people to get vaccinated, but this virus, unfortunately, is here to stay at this point.
These are comments from the last show. I keep my kids out of school all year, and now 4 of them have COVID, literally a week before they could have been vaccinated.
Just a great example of how no good deed goes unpunished. So congratulations for being so diligent. I'm sorry that happened. But I think it also illustrates just how pervasive this virus can be. And, all that effort was not lost. You did a good job, but the virus is tenacious and it is still in the community.
Yeah, and I think the only thing that I want to add to that is that it's also really showing us that the people getting infected by the virus are changing, and we're seeing more and more and more kids getting affected by the virus, and especially adolescents, because they're the population that wasn't vaccinated yet. It's a population that hasn't been vaccinated, and often teenagers especially have high risk behaviors of transmission. They gather, they don't wear their masks all the time, they have large groups, etc. And so it's very, very important, especially now that the vaccine has been authorized in the 12 to 15-year-olds, to get those kids vaccinated so that we're protecting all the children. Because what we're going to see is, as the virus gets smarter, as more adults get vaccinated, right now the majority of elderly adults in Harris County and the city of Houston have been vaccinated already, but it's the young people that haven't been vaccinated. And so we're going to start seeing more of a shift, and we're already starting to see that a lot of the infections are happening in kids, a lot of the infections are happening in young people.
I'm wondering whether or not we need to press the restart button and continue to emphasize, masking and distancing, because this could actually be a real problem for our young folks. Is there a way schools can mandate COVID vaccines for kids attending schools, just like other mandatory vaccines like polio, MMR, etc.?
Yeah, so at this point, usually the mandated vaccines are decided at the state level. Texas is one of the states that, even though there's mandated vaccines, they allow exemptions. They allow religious exemptions and philosophical exemptions and medical exemptions. There's other states that don't allow that anymore. And so right now, because the vaccines are still under emergency use authorization, schools can't mandate them. But if they were to mandate them, unfortunately, there's still going to be some exemptions that are going to be allowed, most likely, because that's decided at the state level. And so that affects the majority of public schools. It may affect some private schools as well, depending on whether some legislation that's currently being presented goes through. But it's a big question. I think it's whether the COVID-19 vaccine should be mandatory, something that we're all talking about, that a lot of businesses are considering, and I think a lot of it will depend on what is decided at the state level, what's decided in the legislature.
If the two of you were the decider, what would you do?
So, I'm going to tell a story that I've told before, but I remember when I was a kid and I got measles. I got both forms of measles when I was a kid. I remember my grandmother being really, really upset about it, to the point where I thought she was angry at me, and that's why all these years later I remember it. But she wasn't angry at me. She was angry that somebody had infected me, and that was because we lived in a society at that time where measles was pervasive enough that we knew the horrible things it could do. Every family had been touched one way or another, whether somebody in the family or a neighbor or a distant relative, somebody had experienced the devastating impact of measles. And so she was angry that somebody had infected. So, we're not there with this right now. But the point is that for those families that are, in particular with the children who are having the negative output, they can be devastating. Like, most kids do fine, but the kids who do badly, some do really badly. And this MSC for children, and now we're seeing the long haul consequences in kids. We're seeing some kids who've got permanent heart problems, permanent neurologic problems. Those families have got rights too. And so, it's a delicate philosophical question and political question, unfortunately, but I would lean on protecting everyone. And so if I had it, I would mandate it. Yeah.
I agree.
When people should get tested when entering the airports.
So, here's the thing about that question is that if you did that, and I don't know that that's a bad thing, but then you can't just limit it to airports. It would need to be any congested setting. So all stadiums for every football, baseball, basketball game, every rock concert, every graduation. So, and here's the other thing: if you get tested and you're positive, then there has to be an action. Why get tested otherwise, right? So there's a lot of baggage that comes with that thought. I would rather that people got tested on a regular basis and just, as a routine thing, as opposed to only for a particular event like going to an airport or going to a stadium.
So last week, I gave testimony at the state capitol. Before I went in, I had to show that I was vaccinated, and they gave me an armband. A couple of months ago, I did the same thing. I just happened to not have had my vaccination card or a picture of the card with me. And so I did have to have a test before I went in. Asking for a family member currently in a hospital out of state who was just put on ivermectin. How long before you know ivermectin is working? If it doesn't, what is another possibility to take in a hospital for a last chance medical?
So Dr. Rivera and I just had a conversation this morning about the use of antiparasitics. So ivermectin is an antiparasitic. It's not an antiviral. but there is some evidence in the laboratory that some antiparasitics can function as antivirals. So ivermectin is currently not recommended. So I'm surprised to hear that this family member that's out of state, which suggests they're still in the United States, is getting it, because it is not FDA approved for this purpose. And what we learned this morning was that even in the laboratory, the dose of ivermectin to become an effective antiviral is high enough that you can expect to have more problems with the ivermectin than you can with, to get to the point where it would be a functional antiviral, you're running the risk of lots of problems with the ivermectin. So I'm surprised to hear that. And there is no other, there are no, silver bullets at this point. The hospitals are using, a lot of different things, but unfortunately we don't have something which is recognized as a cure. Dr. Rivera, do you have anything to?
No, I completely agree. I think it sometimes when patients are really ill, some providers will just kind of start trying anything that's available, and so that's how ivermectin has gotten some traction in certain states by certain physicians, and then in other countries. But there's more studies that are gonna be looking into this. There's more studies that are looking into just different medications that can be repurposed to use for COVID-19. But otherwise, I completely agree with Dr. Persse.
Okay. Duke Human Vaccine Institute study is looking at a pan-coronavirus vaccine that triggers neutralizing antibodies via nanoparticle.
Yeah. So I happen to know a little bit about this. So this is just like the mRNAs were seen as being a new novel way to create vaccines. And actually that had gone back about 10 years, but certainly the COVID vaccine we have now is the first widespread use of an mRNA vaccine. So this idea of using nanoparticles as an antiviral or even as therapeutics, there's all kinds of possibilities. So one thing to understand is that the spike protein is like a key, and the ACE2 receptor on the cell is like the keyhole in the door, in the lock. So that key has to fit in order for it to work. Now, the spike protein mutates and it changes, and some of those mutations make it so the key won't go in, and those mutations just die off. They don't get to replicate. But the other ones are the ones that we have challenges with, in that maybe the vaccine will cover many of these mutations, but there will be a mutation where the vaccine won't create an antibody, because the antibody comes, it gets onto that spike protein and it prevents it from being able to get into the cell. So the nanoparticles are another one, but nanoparticles are small, and what they latch on to a specific spot on the spike protein that appears to be an essential form, and it's a physical form that the spike protein has to have in order for it to attach to the ACE2. And it appears that the nanoparticle can get on there and actually prevent, as far as the theory is that any mutation, that the nanoparticle will fit onto this absolutely critical part of the spike protein, and therefore once the nanoparticle is on there, the key will no longer be able to fit into the lock. Now, that's the current theory, and that's what they're trying to research at Duke. But I think that one of the really fascinating things about it is this: now we're using a nanoparticle, and mRNA was the new thing, now nanoparticles, and if this works, and even if it doesn't, just the fact that we're doing research in it, I think that coming out of COVID, we're going to have a couple of major game changers in terms of healthcare in the United States. And so even with the mRNAs, there's already research being done to look at vaccines against people who currently have certain cancers, because again, it trains your immune system what to look for, right? And this whole thing with the nanoparticles, this is going to be fascinating. So of all this badness, I do anticipate some goodness coming out of it.
Harris County continues at a red threat level. That means for us to stay home. Shouldn't it tell us to go outside and not stay inside? What can we do that we are not able to do now once the threat level declines?
Yes, I can take that one. So the main thing that we are seeing with the threat level red is that you should try to limit activities that are not necessary, and by stay home, it doesn't necessarily mean stay indoors home. but really try to limit group gatherings, try to limit going to large group events, concerts, etc. Try to limit some of the high risk activities, because what we know is that the virus is still in our community. As Dr. Persse mentioned earlier, there's still at least 100 people getting hospitalized a day. Once the threat levels decrease, like for example, let's say we go to the orange level, that doesn't mean it's business as usual. It just means that we can start taking some precautions, but perhaps start doing some of the things that we hadn't been doing. For example, the libraries may open when we're at threat level orange, and we can start gathering perhaps in small groups outside. Right now, any form of those gatherings are still discouraged because of the way that the numbers are. And one thing that's really important to note is if you look at the threat level system, a lot of that it has all been updated based on whether or not you're vaccinated. So if you're vaccinated right now, you can gather with other people that are vaccinated without masks. You can start resuming those family functions, and so it's a really good way to start doing all the things that we all have been missing is to get vaccinated. And so looking at the vaccine as an opportunity to get back to that normal.
Okay, once Israel reached 55% vaccine rate, their hospitalizations and cases dropped. Is that what occurred in other locations, and is it expected here?
So I'll take that one. I would point out that Israel is a unique situation in the way their healthcare system is structured, such that they have the ability to get some really excellent data as to what is going on in terms of hospitalizations, deaths, vaccination rates, positivity rate, etc. So it's hard to say if we're seeing the same thing in other communities. And the other thing to point out is that here in the United States, it's probably the other nation that has got more vaccine into its populace than most countries on the globe. So a couple of things there. But to this question, the one thing that I want to remind everyone is that the impact of vaccine on the disease prevalence in the community is not an on-off switch. There's not a threshold that you hit and then everything gets better. It's, you said it's not an on-off switch, it's more of a dimmer switch. So you have to be a little bit careful as you interpret even the data coming out of Israel, as robust as it is. So, but the takeaway is that, as they got a substantial number of people in the community vaccinated, they started seeing the hospitalization rates go down. And that's exactly what you would expect. My concern is that people think, okay, we get 55% hospitalization rates go down, now we can stop. Well, to some degree, that's the exact situation we're in here in Houston. So we've got lots of vaccine available. We are having a hard time getting people to go. And yet, the amount of illness in the community has come way down. It's come down to 100 people a day are getting hospitalized. That is not a low enough level. And none of us should be satisfied with that. So that's the one thing that I want to, people recognize as we talk about this question. There's no threshold.
Okay, I got quite a few more questions, so I'm going to. Those vaccinated can get together in small groups, but when I chose to wear a mask in a crowd, I've been called one of the sheep. I've tried smiling, but that won't work behind my mask. Any good comebacks you can suggest? I just ignore them.
Yeah, I'm protecting myself. I'm protecting others.
Absolutely.
Why are you not?
I'm confused on the guidance on summer day. I'm confused on the guidance on summer day or away camp for kids, which means mostly staying outdoors. Mask, yes or no?
Yeah, so right now, if the kids cannot be more than 6 feet apart, then the recommendation still is masks, yes. However, last night the CDC did say that they're going to be making some additional recommendations to the K through 12 guidance and also the summer camp guidance. And especially if kids are vaccinated. So if the 12 to 15-year-olds are away at summer camp and they're vaccinated, then we can probably start removing those masks.
So really, vaccinations is the key to this. Mm-hmm. Many in my office do not want to go back to work in person. The company wants everybody together and believes people are more productive that way. We've been able to hold out because the CDC has issued no guidance for employers. Do you think the CDC will make an announcement anytime soon?
So I think that you're going to see increasing guidance coming from the CDC on a number of things. I think what you're first going to see will not be specific to workplaces, but you're going to see things about masking and social distancing as it relates to those who've been vaccinated. You're going to see, you've already got some guidance from outdoor. I anticipate that we'll see something along those lines for indoor next, which sort of suggests the workplace. The CDC does have some guidance for workplace in terms of ventilation and the standard sort of spacing stuff, but I don't know that it's going to be to the level of detail that this person is asking for, and you may have to extrapolate from the more general guidance.
Just when I thought there was no flu season, it appears PIC, pneumonia, influenza, COVID, is listed together by the CDC. How is the flu actually reported, separately or together with the three? I've not seen that.
Yeah, so the CDC reports flu-like illness usually as one. However, they also keep track of the number of positive flu tests. And so what we know is the number of positive flu tests in this flu season was dramatically lower than other seasons.
Should schools mandate vaccines when Pfizer is completely approved?
We already touched on that one a little bit, but our opinion is if we're going to protect our kids, yes, we would recommend that it be mandated, but it's going to be a decision that happens at the state level.
For youth sports, if a positive case is found or contact is made with a positive case, but the child is vaccinated, what is the protocol? I don't know that we have that yet, do we?
Well, the only thing that we have is that if you're vaccinated and you come into a contact, you don't have to quarantine, sort of globally, not specific for kids or sports or anything.
Okay. We have no idea about the connection on fungus and COVID. A relative with COVID tested positive for aspergillus, and I see in the news about black fungus in India's COVID patient that seem to be prevalent. Rare. What is precautions and treatment are there? What precautions and treatments are there?
Yeah, so
go ahead.
What I was going to say is that in all severe respiratory illnesses, especially if you end up in the hospital or you end up in the ICU, there's always the risk of getting a co-infection with a fungus similar to aspergillus or one of the others, because especially if you're on a ventilator, if you're getting any form of respiratory treatment, it's just as kind of a breeding ground. And so preventing COVID is the best way, or preventing any other severe respiratory illness. Otherwise, there are medications that can treat the fungus specifically, but it's typically not a great sign, not a great prognostic sign once you start getting infected with some of these others, because typically it means that you're on some form of respiratory support.
The New York Times said that we can't get to 70% vaccinated by September, regardless of what politicians promise. Your ideas about that?
Well, yeah, I mean, it all depends. It depends on two things. One is, the rhetoric and people, being the anti-vaxxers, and also on us in public health and the healthcare practitioners getting vaccine out into those people who are willing to get vaccinated but find it difficult to get vaccinated. So that's what we're spending a lot of our effort on now. 70% it's turning out is a high number. So I'm keeping my fingers crossed.
Well, I want to thank you for joining us for COVID-19 Talk with Local Health Authorities. Joining me was Dr. Maria Rivera, representing Harris County, Dr. David Persse, representing the City of Houston. Special thanks to Kathy Finninger, Rotary Club of Houston, and Morgan Ash, our producer. I'm Stephen Williams, the Director of the Houston Health Department.